As the rollout of the Affordable Care Act continues, many people with individual health insurance are receiving notices that their plans are being phased out. They're then given a new option for a more comprehensive plan that meets the health care law minimum guidelines. But how can you be sure your plan is being dropped for the right reasons? News 8's Carrie Vick joins us with a closer look.
Well, there are two reasons individual health plans are being eliminated. The first is if it's a plan that does not meet the Affordable Care Act guidelines, which requires all plans to cover things like prescriptions, maternity care, and mental health coverage. The second is what's known as the grandfather clause, which allows you to keep your plan as long as no changes have been made since 2010. Now, if changes have been made, insurance companies are required to drop those plans, which has some upset because they're being forced to pick out a new plan.
They're upset because now to get a plan, even at the very minimum level of the Affordable Care Act, requires, all these different, coverages at even a minimum level, which of course is going to cost more money than a very cheap, very poor plan.
Your insurer should give you the reasons why your plan is being dropped. If you're not given a good explanation, there are some steps you can take to make sure you're being treated fairly.
If there's no explanation, it just says your insurance is canceled, then they should, I'd say call, but generally what happens when you call a big bureaucracy is your phone call gets lost. So what I would do is I would write a letter to my insurance company, okay, and I would copy the Office of Insurance Commissioner.
Now, if you would like more information on how to reach Wisconsin's Commissioner of Insurance, you can visit our website at news8000.com.
All right, thank you, Carrie. If your health plan is phased out, your insurer is required to give you 90 days notice. They're also required to give you another health plan option.